From the southeastern corner of western North Carolina, this is Folklore. I'm your host, James Hernishan. Let's play a game of Would you rather? Would you rather be a superintendent of a public school system in North Carolina or the chair and treasurer of a rural hospital? Meet the guy who has done both. I didn't ask Bill Miller to play that game in this episode, but given the way things are headed in this state, I'm willing to bet he's pretty happy with his decision to run Polk County Schools first and then move to St. Luke's Hospital Board of Trustees later, instead of the other way around. Still, it can't have been an easy decision. Overseeing a rural hospital isn't exactly a soft landing as you approach the retirement phase of your career. More than 190 rural hospitals in the U.S. have closed since 2005. According to the Center for Healthcare Quality and Payment Reform, 30% of the ones that are still accepting patients are at risk of closing. Usually, the problem comes down to simple math. Most of the revenue at rural hospitals comes from government insurance, Medicaid for low-income patients, and Medicare for the elderly. But it often costs more to provide that health care than what the hospitals receive in reimbursements from the states. Why the gap? Ask a politician. Making matters worse is the reputation that many small hospitals far from the big cities have acquired. Here's what one South Carolinian told KFF, one of the country's largest health policy research groups, last year. If you have insurance and a car, you'll drive out of the community for care because a perception exists that bigger, brighter facilities offer better quality services. But St. Luke's is not about to shut down, and it's not having trouble finding qualified staff, and it isn't facing a major funding shortfall. In fact, its accounting department is probably going to have even more flexibility in the years ahead thanks to North Carolina's decision to finally expand Medicaid eligibility to another 600,000 residents. The nuts and bolts of running a 25-bed hospital, even one with a $50 million budget, don't usually get too much attention. Unless, of course, that hospital is on the verge of closing up shop. But I thought it would be a good idea to ask some questions now, while things at our nonprofit, community-owned hospital are going so well. My guest agreed, so we sat down for a chat at the end of September in his old stomping grounds at the Stearns Education Building in Columbus. Bill Miller, welcome to Folklore.
It's great to be here. It's a good opportunity to talk about St. Luke Hospital, something that's important to me these days, and really always has been as a community member here. So happy to be here, James. Thanks a lot for having me.
Well, St. Luke's is an important part of the community. It's our only hospital, and it's our primary health resource for a lot of people in this county, isn't it?
No question about it. And I've always believed, and I think many of our citizens believe, if we were to lose our hospital, I'm not sure what would happen in our community. You know, the major business, like it or not, in Polk County is retirees coming here. And I'm not sure many are coming or staying if we don't have a hospital. So St. Luke Hospital is just a major driver here for a lot of reasons, the number of employees it has, but also without it, I'm not sure we would be the rich, full community we are. So it's an important thing for sure.
Well, Polk County does do well on a lot of indicators compared with the rest of the smaller counties in North Carolina, but rural hospitals are not doing well as a whole in this country. I was looking at a map this morning just showing all the ones that have closed down in the last year or two. And
yeah, scary.
It is scary. So what are the biggest pressures that St. Luke's is facing that are making life difficult for rural hospitals?
Well, that's a great question and one that could go on all day probably, but I'll try to hit a few things. One is that, change is just at an unbelievable pace and significance in healthcare, something I never realized till I got involved with a hospital. I really thought we had a lot of change in public schools, and it came fast, but in all honesty, nothing compared to what comes to them, the pace it comes, and like I say, the depth of it is just amazing. And that's just a difficult thing for any organization, really, is just that type of change and how quickly it comes and what they have to do. So, that's one. Like all healthcare facilities, there's a lot of financial challenges that just go on constantly. Some of those are around some of those changes, but some of them are just structured into the whole delivery of healthcare in our society. So that's a difficult one. Another one for us, I think, our location is a challenge. even though it's great for those of us that live here because we can get to Greenville or Spartanburg or Asheville or Charlotte or wherever really quickly, in healthcare, that's a challenge because people can get to those places quickly. And in North Carolina, we have two of the probably nation's most prestigious healthcare facilities at Duke and at Chapel Hill. And so people from here can get to that easily. So that's a challenge. And it can draw people away from our service area to get things. So another one is just the staffing issues. So, any organization, James, you know this well, is really about the people. We give names to these places like Polk County Schools or St. Lakes Hospital, but really all it is the people. The people are the institution. And so it's an ongoing challenge to keep quality people. There's shortages in healthcare providers in all types of areas. And so keeping the people here, paying them what they can pay in some of those other places is just an ongoing challenge to make sure we have the best care we can have for our community. And so that's one. And the last one I would probably highlight is we're a small place. We've got to be aligned with partners to make it. And so for the last 10 years, we've been aligned with Atrium Health out of Charlotte, which is an enormous operation all over the country, kind of. And they've been a great partner for us that helps provide us buying power, a lot of different services that they, by being a partner with them, that we receive, allow us to kind of exist and continue and operate with some of the scale of a big place, even though we're a small place. So continuing those partners is a big deal, I think, for our hospital here. As a board and as administrators at St. Luke's, we're constantly evaluating who are the best partners for us to be aligned with. I think that's going to be an ongoing challenge and an ongoing, almost yearly thing of, is partner A still the best place to be aligned with, or now we need to move to partner B because they could provide us X, Y, Z? And so I think that's just an ongoing challenge here for a small place. And, some of this is all around the fact we want to keep our small hospital here. We do not want to become just an urgent care. We want to provide comprehensive services to the citizens of our community, and these challenges are all associated with the fact that we want that. We want Cadillac, even though we're a small place, and that just brings some of these challenges.
If I was thrown into the responsibility of overseeing a big institution of some kind, I would think about two big things as far as the budget goes: technology, equipment, and staffing. So St. Luke's seems to have a bit more of both. Like you have good scanning technology, right?
Yes. So I'm going to give that credit to the citizens here. So now I think our administrative staff has done a fabulous job in looking for grants, receiving those grants, doing things. We're a rural access hospital, and getting that designation is a big deal because the money it allows us to draw down. But when we need equipment, our community has stepped up. When we felt like we needed 3D mammography for our citizens here, our foundation went out, raised the money in just a matter of months to put that equipment in place. When our cardiology program started up and Dr. Kemp believed, we needed the best possible scanning, I think our board agreed. What is the purpose of having a world-class cardiologist here if he has to send people to Charlotte or Raleigh to get the scans he needs to make that happen? So there's only two of these east of Raleigh. One's in downtown Charlotte and one's in little old Polk County. 512 slice CD scanner. Like I say, only a few in the state, which we have one, but that happened because our community raised money through our foundation, over $1 million, to make that happen. And so one of the advantages we have here are retirees that do have some sophistication and some financial resources. They believe, thank goodness, that our hospital is important. And when equipment's needed, they've tended to step up to make that happen. And so there's that kind of piece. The staffing piece, I think we do have a little bit of advantage. It's helped us some because we're where we are. This is a great place to live. It's a great place to raise your children, and centrally located here between Asheville, Spartanburg, and Greenville. It's easy to be here, but get resources and do things, have arts, have other things that our community, this area provides. And so we've been able to get some doctors and some skilled people that are willing to work at St. Luke's and be here because this is a great place to be and work. And so that's helped us. And I think many times there's personalities of doctors and providers that they don't want to be just a number at a large medical facility where there's a lot of regulation and a lot of things they have hoops to jump through. They like being part of St. Luke's because it's small. They're in direct contact with each other and the CEO and the board, and they're able to make things happen here at a pace that I think they like, and so that has helped us some.
Well, I am curious about the challenge of attracting qualified medical staff because these are relatively well-paid individuals. I mean, how do you compete with, say, Charlotte, our closest big
Yeah, I think it's part of what I said before. I mean, Dr. Kemp, who we're just so pleased to have here now with our cardiology program, came from Vanderbilt, where he led a group of like 70 cardiologists. And, he came here because I think he was ready to get out of that type of medicine, and that helped us recruit him. They're equestrian people. That helped us because they were looking, for something like that. It's a great place to live and be when you combine the things that our mountains at Western North Carolina provide, and it's just a good place to be and live. So that I think that does help. We aren't necessarily going to always get the young person straight out of medical school that wants initially looking for big money, big setting to do those things, but we can attract some people that are looking for something a little different later in their career, and they provide a lot of expertise to us. But it is a challenge. There's no question about it. Just keeping the skilled nurses and the specialists we need in these programs when they can make what they can make other places is just a very difficult challenge. Atrium helps us with that some. I mean, they help us search for doctors, for specialists, help us find people. Their reach is enormous. Out of Charlotte, and so they help, but a lot of it is just bringing docs and people here. When we recruit doctors to come here, one of the first places we take them to have children is the CPOCANE schools and what it provides. If they're into the equestrian center has been so helpful in showing them around, seeing that part of our world. If you're into the arts, Trying Arts and Crafts, Trying Fine Arts Center, all been so supportive in helping us recruit these people. So part of it is just selling our community, our hospital, those things, and we've had some success with that, but it'll always be a challenge.
Do you have to rely on sort of like part-time folks who divide their responsibilities between different hospitals? Because I know in other parts of the world that's often the case in rural areas.
We try not to do that, but sometimes you do because you have no choice. And we try not to have, in their lingo, travelers or people who travel around and they can make high pay because they just do fill-in work in places where there's just, kind of a desperation situation. They've got to have this so they can draw high pay. We try not to do that. Atrium tries to help us keep from having to do that. But Atrium themselves have huge numbers of those people in place. And so we have our share too. You try to stay away from it because of the cost, but it's sometimes you got to have a provider in place. So sometimes you have to do what you have to do to make sure the patient's served.
I mean, there must be some things that St. Luke's is just not, doesn't have the capacity to provide, and you have to send them somewhere else, right? What kind of things basically is just beyond the scope of a hospital the size of St. Luke's? So brain surgery, it would be.
Yeah, so I think we do have to have some sense of ourselves. Like what are the things that we can provide that are important to our community that we can do well, but yet we're not going to do brain surgery. And we have docs that have enough sense, hopefully, to forward people to where they need to be for that. And with the internet, people have the ability to figure that out for themselves. Let's be honest. They know the best brain surgeon in the South is at Duke or whatever, so they figure that out. So we aren't trying to be all those things, I think. That's a good point. But there are things we can do, that do matter here. We have a lot of retirees, so cardiology is just one we wanted to start up because it just fits who we are, who our community is. Cancer and our new infusion center and all the work they're doing. I think that It's just a terrible disease that affects a lot of people, and we have it too here, and so it's a biggie. Orthopedics is a big one here between just citizens that are injured with joints and our older people, retirees that we have those needs, and so having those orthopedic programs are big. So I think having quality emergency services in our emergency room. We have a contract with a big place to help, provide that and make sure that, every doc in our emergency room is emergency room certified. And that's a high certification and a high level of training to make sure they've seen everything and know how to deal with about everything. And that's important here. So you're right. There are things that we have to just have a sense of ourselves, or what are the programs and things that we can provide that are important to our community, but not try to be everything to everybody. We can't do that.
Well, I think if someone is going to choose to settle down in Polk County, they have to realize that a rural community is not going to have the same kind of hospital services that
Right.
Charlotte or Raleigh would, right? I mean, so in other words, is it fair to say that people, by and large, are understanding of the fact that part of rural life means that your hospital has to choose what it can
Yeah,
do?
that's a good question. I don't know the answer to. I hope that's true. I mean, I hope people understand that.
I asked this because I was just having a conversation the other day with somebody. We were talking about municipal services, and
Right.
it seemed to me that this person who was having a genuine problem with the city just, was making an unrealistic demands on a small town.
Right.
If you want to have a symphony orchestra to see every weekend, you don't live,
Right.
300 miles away from the nearest symphony kind of thing, right?
Right. So I mean, I think there probably is some of that, but at the same time, I think our board and our community is committed to having a pretty comprehensive hospital program here. That it is important, but you're right. That takes a balance of understanding of we can't do brain surgery, and so I hope citizens understand that. But at the same time, I think there's some expectation that we have great emergency services, that we have some programs that people need, that we have partners that we can connect to get people the other services they need that we don't provide, and that we can get them those services quickly. And I think we have those partnerships in place.
All right. Now, you brought up emergency services a couple of times. So that kind of brings me into this thing I'm really interested in talking about, the impact of the new North Carolina budget, which is going to go into effect any day now, I guess. It increases Medicaid coverage. 600,000 more people in North Carolina are going to have access to Medicaid. So how does that influence a hospital like St. Luke's? And I'm thinking, my first thought is, well, people who don't have insurance, they go to the hospital, you still have to treat them. They show up at the emergency room. But if they're on Medicaid, it's no longer as big a problem for you, right?
Right. So that is a really big issue for us. I think we have calculated it. It's about $1 million hit to St. Luke's that we will get in additional revenue. And part of that comes from exactly what you were just talking about. So we provide probably about, I think it's rough, don't hold me this number exactly, but I could get it from Michelle. I think we provide about $5 million a year in free care to our community of people that come and don't have insurance, don't have a way to go to the doctor, and they come to our emergency room, and we provide that type of care over the year. And that's important to do, and we should do it, and we're going to continue to do it. But having some of that offset is a good thing too. So by putting more people on, we feel like that's going to be about, our finance people calculate that'd be about $1 million extra for St. Luke's, and that's in a small place. That's big money, and so the expansion was an important thing to us, like it was most rural hospitals in North Carolina, and so we're excited that it's going forward for several reasons. For us financially, but it's just good for citizens too. It's going to have more people able to get the care that they need. And that's important as a state and to have a great society, really. So that's what we're all about.
Do you have any ideas what you're going to do with that extra $1 million?
Well, no, it really just is just becomes kind of part of the budget and part of what we do. You always need new equipment, new facility upgrades, increased salaries. It all just will become part of the mix of the revenue formula that we have to look at every year as we develop a budget about how we can fund all the things we want to fund at St. Luke. So it's not like we're going to have this $1 million sitting out there and suddenly have to decide. It'll just be part of that mix of what we get every year. And some years you're down, some years you're up, and so it'll be part of the mix. But in the big picture of it, has got to be good for St. Luke's that we're going to have more people showing up with some type of insurance coverage.
What's the overall budget for the hospital?
Wow, I'm not sure I can tell you that off the top of my head. I'll just sit here right here today.
Okay.
It's big.
Okay, well, maybe we can get it later, and I'll put it in the intro. But
yeah, that'd be good.
Because $1 million, what that means depends on.
You're right.
It fits in the big picture.
You're right. It's all relative to the overall picture, and that's why I think that'll just be in the mix of what we have to do and have to provide. And so, when you have to buy equipment like a hospital does on a continuing basis to have the newest. You want to have the best, like used cardiology. I mean, we don't want to have a scanner that doesn't do what it needs to do. So suddenly you need $1.5 million to make that happen. And so there's always going to be that ongoing thing of equipment and stuff. So I think it'll just be in the mix.
Now, St. Luke's it's a community hospital. I mean, it's part
part of
the fabric of this county, which means that everybody's really got a role to play in either supporting it or using it wisely. So what should the people of Polk County be thinking about in terms of how do I avoid having to go to St. Luke's? In other words, what are the big healthcare challenges that St. Luke's ends up doing that you think maybe, the people could play a role in dealing with?
Yeah, one, in a rural place where you have poverty, and we have that, whether we like it or not, we just do here. And I think sometimes that's not as understood by all our citizens as it needs to be, the amount of poverty we do have here in our community. The people in those situations, just access to health care is just a big problem. Not having the financial resources or insurance or whatever to just go to the doctor. To get all, now in modern science, the amount of screenings there are to help people prevent illness before you get it are just amazing. And I think of the the new 512 scanner we've got, it can do calcium screenings. So I went and had one done. So for $99, you can go, and this machine will look at the calcium buildup in your arteries to help your cardiologist look at, are you susceptible to a heart attack or a stroke or whatever. It can do that for you. So we're doing them at this huge reduced rate just to help citizens, but that's all part of, you got to have the initiative as a person to go over there and do it. You got to learn about it. And so one of the challenges, certainly in a small place, is just access to health care and taking advantage of the services that are there to get your citizens to do. So that is the thing. But we do these health surveys. And so our surveys continue to show here that the two drivers of health problems here are cardiology and cancer. And so that we have just a lot of our illness is around heart disease and cancer. And so that is associated with the age of our population probably, but it's also out in society. Those are just big issues wherever you live in America. So because of those things, we continue to emphasize our cardiology program. We've started that up. It's going well. It's growing. We're getting ready to add another line of cardiology services. Our infusion center is doing real well. It's providing, I've got a good friend that I'm sorry to say has cancer, and instead of having to go to Asheville or Greenville or wherever, he's receiving those services right here at St. Luke's. It's so much more convenient for him to have that here and have that same quality of care here that he would receive somewhere else. So two of our big issues here locally, or I think three, are access for our citizens to the screenings, to doctors, to health care that they need. And then our surveys show that the two drivers here of major health problems are heart issues and cancer. And we're trying to attack those things and make sure those services are here in a quality fashion for our citizens so that they can access those things, if that answers the question, hopefully.
Well, the other thing I'm curious about is kind of like the profile, the reputation of St. Luke's in the community. people might think that it skews its services towards older folks
Right.
because, well, we have a slightly older
Yeah.
population in
Right.
this town. So, do young people really not make use of St. Luke's facilities?
I think they do, but the truth is, younger people go to, they just need less services. When you just look at it mathematically,
Yeah.
when I was in my 20s, I just didn't need to go to the hospital much. I mean, unless I was in an accident or something, you don't take advantage of it. But where that comes into play as a younger people and younger children, you do need access to the emergency room because things happen, life happens.
Well, young families.
Yes, they need access to a quality emergency room when the child falls in the backyard and breaks their arm or whatever it is. So I feel like that's an important piece of what we have and need to have. But we need to continue to work hard to make sure our citizens understand the things we have that they can receive testing for to help prevent disease coming to them. I mean, I think research has shown over time, just getting screenings for whatever that is, whether it's, prostate cancer or it's breast cancer or it's this calcium screening for heart attacks or whatever it is, reduces by over 50% the likelihood you're going to have a major problem. And so continuing to communicate to our citizens, boy, these tests, these things are available at our local community hospital where you can receive those things. Oh, and stop allowing a problem to get to the point that you can't recover from it. So I think that's a big thing for us, and we need to continually emphasize that to our citizens. And we want our citizens to not confuse being small doesn't mean inadequate. And we don't want people to think that. I would put our cardiology program or our infusion or our 3D up against anybody's. And so don't confuse small with inadequate. We have good programs, good things, healthcare close to home. You don't have to fight the interstate traffic. You don't have to fight the bureaucracy of a large hospital. You can know your doctors, our CEO, people here. You can get in out of our hospital easily. And so I think just continuing to educate our community, whether they're young or old citizens, about the quality of care that we have close to home, you can take advantage of. It's just a big thing. It's an ongoing battle that needs to keep going on.
Well, I ask about the profile in the community because I've seen recently now billboards that you're advertising your new doctors,
Yes.
your new services. So it's always been interesting for me to see hospitals try to advertise and sort of change the way they're seen in the community, because I'm sure there are still a fair number of folks in Polk County who would choose to go to Spartanburg, say, instead of St. Luke's, maybe just because they used to do it. I mean, St. Luke's wasn't always the way it is now.
Right.
I mean, when I moved here 18 years ago, I think it had some problems.
Right.
And there might be people who have just through inertia are still going outside of the county when they could just pop in for a screening to St. Luke's, right?
Right. That's what we want to try to get people to understand. We have quality things here. But, one of the challenges I think healthcare has, just like public schools have, it only takes one bad experience with your child in a school system for you to turn south on the school. And you can understand that. A child is a person's, they only got one sometimes, or it's a dear thing. And a bad experience for that child can really turn people, sour on the system. Well, you only got one set of health. And we try to emphasize to our employees and the hospital staff as a whole, one bad experience here will run through all families, all its relatives, and turn a generation of people against us. And so we have to work hard to make sure that the quality of care, you bend over backwards to provide people with good service here. And I think our staff and our people do that. But you're right, it can be a challenge in a small place because one little bad thing spreads through the community, and then you got a group turn that's going somewhere else. But so we're working hard to make sure that's not true. But it is true, as you said, and I said in my opening comment. I mean, you can get from here to some pretty big places really easily, and for some of things, you need to get to those places, and we'll help you get there. because we don't provide that. But there's just a lot of great things we do provide here locally.
All right. Well, can we go back a little bit to the state budget? I mean, I know it's kind of new, but you must have been paying attention to the healthcare
Sure.
provisions.
Yeah.
What else is in it that might be of benefit to us here?
Well, we've got some things that it's too early to talk about, but we're trying to get through the federal budget for St. Luke specifically, and our local politicians are helping us with that. They can help us with some upgrades to our infrastructure, and we're working hard on that. Hope that'll happen. Too early to talk about that now, but I think that's in this state budget. The particular thing that affects St. Luke so much as a rural hospital is the Medicare expansion. I mean, that is the biggest. Are there other things in there? If you know much about the state budget, you often don't know what's in there until after the darn thing comes out and you can look at it. So I don't know personally of anything specifically that's in there for St. Luke's other than the Medicare expansion, but who knows? There could be.
Well, when we look at Medicaid, the big fight, because North Carolina is like 10 years behind much of the country in expanding Medicaid.
Right.
They complained that, yes, the federal government is going to give us 90% of the cost of expanding Medicaid, but the other 10% is going to fall on the hospitals. But now I understand that the federal government's actually going to cover some of that too. So I'm a little bit confused.
I am too, probably. So I don't know the answer to that specifically. That's a good question, probably from somebody above my pay grade to know how that's going to play out. But in the big picture of it, I don't think there's any question. It's, as we said earlier, it's good for our citizens. You got a huge number of people coming on that are going to be able to receive care that weren't on before. And small rural hospitals are going to benefit from that, not because we're just giving a gift, but it helps offset this free care that we're providing anyway to people and should provide and would continue to provide if we didn't receive it. But receiving funding for some of that care in a small place like this is a big deal. And another thing that's important for us to continue to work hard with our local representatives and our national representatives on is, we're a rural access hospital. And that's a big deal to have that designation because it allows you to draw down funding at a higher rate than they can in Charlotte or Atlanta or Raleigh or wherever. So we may receive, as an example, for Service X, whereas they get 100% funding, we get 125%. So we'll get a little bit of extra money to help offset the fact we're a small rural place where it costs more to operate. We don't have the benefits of scale, and so we get a little bit of extra money for that. So it's important for us to continue to advocate for that type of system needs to continue to exist in America, or you'll end up, if you do not do that, with a situation in our country and our state whereby the only hospitals are in big cities and no rural part of our nation has health care. And that's a scary thing. As you said, when you open, there's small rural hospitals all over this country closing left and right. We have been fortunate not to be in that situation, I think partly because of our designation, which helps us receive extra funding, our local support, our foundation, the fact that our citizens recognize we need a good hospital here and have been supportive of it. And so for a lot of reasons, we've been able to kind of ward that off. We've had a great partner in Atrium. Continue to look for partners that we can work well with together to provide things for our community. So all those things I think have allowed us to stay in place. But as a country and a state, it's a challenge out there for small rural hospitals.
What about the political dimension, our elected leaders? What kind of support does a hospital need from its congressmen, from the state legislators, from county commissioners?
So part of this goes to my belief I've had both as a school administrator and now as part of the hospital board. One little small part of St. Luke's Hospital is I've always believed what you should expect from your political leaders, whether that be your commissioner, state or federal, is that they listen to you. You can't make them do what you want. They get hit from all sides with wants and needs, and there's more wants and needs than they can solve. But I do think you can expect them to come, listen, evaluate what your situation is, and then put that into the mix that they have to have. I think if they don't do that, you're in trouble. So we've been fortunate here. Our local representatives statewide have been willing to come visit St. Luke's, tour. Our state house member, Checkers, has been here. He has toured St. Luke's. He's helping us with potential some federal dollars on some infrastructure needs. So I think asking them to come listen is just something you could expect from politicians. We have a county commissioner on our board. Our commissioners here have been, willing to listen, but they can't help. So our commissioners don't own our hospital,
Right.
So they don't really fund it. But at the same time, they've been willing to be part and be a partner and help look at ways they could help, or help evaluate what we need. And so I just think I go back to, you can expect them to listen to you, evaluate what you're asking for, evaluating do they really need that, and helping when they can. And I think we've received that, and we're pleased about that.
It brings up an interesting question for me. Whom do you answer to? The board. Who's board responsible to? Because it's not a government entity.
Yeah, it's a great question and a hard one to answer. So really, we answer to the citizens. So our board,
but not directly.
Not directly. I mean, I guess we do. I mean, they don't elect us, and so in that case, it's not direct for sure. But our hospital is community owned by the citizens. It's not owned by. It's very different from Part E Hospital in Hendersonville, for example, which is owned by the county and the commissioners. We're not. We're very unique in that situation, and it's a great question, because I think a lot of people don't realize that. I think if we went and polled people, probably most people think the county owns St. Luke's, but they don't. It's really the citizens. It was set up to be here to serve the community and the citizens, and we have a board that appoints people, self-appointing to that board, and a big deal is made out to all board members who come on board. You represent the citizens. Your role is to represent what's best for our community and our citizens in regards to health care. And my kind of 6-8 years experience on the hospital board is the members take that very seriously. It's talked a lot about who we represent and who we're trying to make sure that we continue this hospital and these health services for.
So how do you go about engaging with the broader community to find out what the community needs and answer their concerns?
So several ways. We do community surveys. That's how we know that the big issues here as far as health are heart and cancer from those community surveys. So we know that. We also do patient surveys. So we have Atrium helps us with that, and we have a really large program in place where everyone that visits St. Luke's Hospital, whether that be the emergency room or whatever it may be that you're there to receive service for, is surveyed about your experience there. So we're constantly looking at that experience from several ways, just the service you receive, the friendliness of the staff, the quality of the care, all types of ways. And the board is constantly evaluating, just quarterly, those results, which identifies real quickly, we must have a problem in area X because these surveys are showing people aren't satisfied with the service they receive there. So it's kind of, in some ways, just direct reporting back to us from citizens that are there receiving service of what's going well and what's not. And then we chart those results in several ways. We compare ourselves to other rural hospitals on those results from those surveys. And Atrium compares us to all the other hospitals that Atrium has partnerships with, and they're ones they own. And so we have this kind of board of looking at, here's how we stack up in this emergency services area or whatever, infusion area or whatever, against other hospitals that Atrium has, other rural hospitals in North Carolina. So we try to use those measures and those data points to really help inform us about how our citizens view our hospital.
I, I ask this because I don't think most people in the county give a lot of thought to the institutional nature of St. Luke's. They just think, well, St. Luke's is our hospital,
Right.
and it's important to understand that there's so many different types of hospitals in this country:
Yes.
for-profit, non-profit, and community-owned and
Right.
non-community-owned, and all this kind of thing. Um,
Yeah, and ours is so unique in that there's no government agency providing us funding. It's coming from us having good management, providing good services that people were willing to pay for. We have a unique payer mix here just because we have such an older population that we have a lot of Medicare, Medicaid type pay here, smaller probably insurance number percentage wise than you'd have in a big city. Um, but we work hard to make sure every year we break even or make a little money on the services we provide here, because
and
that's
you
how we have to do that to have the money to buy equipment, do things. I mean, sometimes I think people act like profit's a terrible thing, but it's not really when money's just going right back in a case like ours to your community hospital to make sure you have the services ongoing that you want to provide your citizens.
and you're doing okay on that score.
Yes, yeah, we're fortunate.
Okay.
We're fortunate here, that we've been able to do that. This year certainly been a challenge. COVID years we got through, in all honesty, because the federal government did step up some to help rural hospitals with some additional funding, that because they knew that we were overwhelmed with these COVID cases, at the same time losing all our surgeries and all these other things because people didn't come to the hospital for those. And so we had this kind of double whammy impact of high volume in one particular area that really didn't generate any revenue, losing the services that did provide revenue. So they provided some money to help get us through. So that got us through that time. Very difficult without that. But now we're back going again and providing services, and I think this year we'll hopefully meet our budget. We're in the last couple of months of it, but hopefully we'll meet our budget and have another quality year of services and financially at St. Luke's.
Well, I certainly hope we don't have to go through another pandemic anytime soon.
Yes.
But let's wrap up by looking just a bit at the future. Are there any plans, expansions, or redirection of resources for the next few years? Or are you just going to stick to what you're doing?
Yeah, I think we're continually going to be evaluating, like I said earlier, our partners we have. Atrium's been a good one, but I think as a board, you have to continue to look at, are they the best one, or is now some other partner better? And you have to continue to be evaluating that and looking at that. So I think that's an ongoing, never-ending thing that's just going to be happening. And so going forward, you've got to be very cognizant of that, and I think be on top of what's the best setup for our hospital. But I don't know of any if some magic genie comes down with $150 million, it'd be nice to build a new St. Luke's. but barring that magic genie showing up, I think it will be to continue to look for grants, funding that can help keep our building in good shape, keep our facility in good shape, continue looking for new equipment, grants, resources. Our foundation is just so supportive here to help raise money for equipment that we need. That'll be an ongoing thing. I think we're, in fact, last night, the foundation's meeting, the hospital's asking for money for buying new pieces of equipment that we need right now on the spot. And so they're always very responsive to that. And so I think all these things are just going to be ongoing. It's going to be ongoing fundraising here through our community for equipment that we need. It's going to be ongoing looking for what's the best partner for St. Luke's going forward as changes come about. Who's best now to be aligned with to help us stay, where we are, providing quality services for our community and our citizens. That's never going to go away. Would you like a brand new building? Yes. Is it realistic to think that type of money is coming around anytime soon from heaven? It's not.
Well, you mentioned that twice. I mean, how old is the building?
Oh, well, this is the early 70s. So now we've got a new addition. The orthopedic wing that we added not many years ago, which is a great addition, and it's got a great facility inside it for rehab. And we're continually working to keep our facility up and keep it in good shape. But that's a challenge. There's no question about it.
I mean, the last time I was there, it didn't look like it was falling down.
No.
But like you say, it's like 50 years old, right?
Exactly right. So, 50 years is 50 years. But at the same time, I think they've proven in Europe for a long time, you can have an old building and it'd be just fine if you'll keep them up.
Okay.
And so that, I think, been proven throughout history. And so we're doing our best to do that. And I think we are. And, we're bringing new equipment in all the time and upgrading facilities and things. And that'll just be an ongoing challenge.
All right. Well, I hope that if someone made it through to the end of this interview, they've got a much better idea of what St. Luke's is all about. So thanks so much for explaining it all.
Well, thank you, James. Appreciate the opportunity to be here to talk about our hospital, and because I know how important it is to the community, and appreciate you recognizing that also.
All right. Thanks again.
Thank you.
That's it for this episode. As always, if you've got an idea for a guest or a subject that we should explore, write an email to jamesh@folklore.com. Thanks for listening.